When you get hurt, you go to the doctor, right? Well, not always. Millions of Texans simply do not have access to doctors nearby. Over 6 million Texans live in what are called health professional shortage areas. To make matters worse, 40 of Texas's 252 counties have 0 primary care physicians. In other words, a lot of Texans can't go to the doctor when they are sick or hurt without traveling long distances or long wait times. Increasing availability of physicians isn't an easy problem to fix. It takes a long time to earn a medical doctorate, and once achieved, there's competition in the market for continuing training and residency that's required to fully practice medicine. We all know the laws of supply and demand, but even though demand is great, the long time involved with training new doctors means it takes time for supply to catch up. Thankfully, there is something Texans can do this session that will relieve some of the pressure on our medical students and bring more rural Texans access to care. Texas can tap into a market of foreign licensed doctors who want to practice in Texas, but can't because of a maze of red tape and redundant requirements. Right now, doctors with medical degrees from other countries have to repeat a US-based residency to practice in the United States. This means they would have to repeat anywhere from 3 to 7 years of their medical education they have already mastered, and they would be competing with US medical graduates for a limited number of residency spots. Tennessee was the first state to omit the residency requirement for foreign licensed doctors and instead replaced it with a provisional licensing period. After a review process by the state medical board, a foreign licensed doctor can practice in Tennessee under the supervision of a fully licensed doctor in that state. By omitting the residency requirement for qualified doctors and creating an alternative pathway to licensing, we can do 2 great things for Texas. 1. Reduce the competition for residency spots for U.S. medical students applying for residency, and secondly, quickly increase the number of doctors available to Texans. Together, these reforms will improve the supply of doctors to Texans. Already, 7 other states, including Florida, Tennessee, Iowa, and Virginia, have created alternative licensing pathways for foreign doctors. Other states have introduced similar bills. Their citizens are reaping the benefits of increased access to doctors. Texas can too. It's time for Texas to unlock the potential of foreign licensed doctors ready to meet the needs of Texas and Texans, and in doing so, help promote a healthy Texas that's ready for the future. Stay up to date on this issue and more at texaspolicy.com. We'll see you next time.